helping us to expose the dogs to situations that they wouldn't normally encounter, but that may. For instance, Christine here is getting a Schooner as her balance dog. And Christine is a professor at George Mason University, so to have Schooner be able to train on a campus is like a perfect example of something that would be helpful to us. And being able to come in and out of buildings, and you guys know the grounds and know what kinds of places there are, and be able to possibly guide us to the dining hall and kind of direct us. You're not actually going to handle dogs, so we just want to be clear about that.
Right.
But if we can use you as to set up some distractions, like maybe go out on the amphitheater and kick a soccer ball, and help us with a lot of either distractions or location kind of work, and get us oriented to anybody who might be getting a service dog that's going to be in a similar environment.
In addition to what Peggy was saying for how you all can help, is I run the puppy program, so work with the puppy raisers who have the pups from 8 weeks old to about a year, and their job is just to socialize the dogs as much as possible. So again, not even doing specific task things, but just getting them out to see all of the stuff that happens on campus. So doing meet and greets with you all would be great, for the puppies to learn how to meet people appropriately, just be exposed to a lot of different things. So I probably will be utilizing you to bring some puppy groups onto campus. We can demo what an appropriate meet and greet looks like, so you can help out with that as well.
We don't normally work with a lot of Danes, but this is Schooner. He's training as a balance dog for Christine. This is their first week of learning together. This is Lauren. She's our head trainer, and she has River.
River is 2 years old. She's training to do the physical assistance program for us. So that's going to help someone most likely in a wheelchair, doing things like picking objects up that they drop, which seems like a very simple task, but if you can't bend over and get it, you're always having to ask someone to do it for you. So it's a huge help for people who are in a wheelchair. Opening doors, going to get help, just generally being their hands as needed. She might be a home placement for someone, which means that they don't need a dog as much out in public, and she'll be their little helper just around the house. So we can show some things that she can pick up just to demo that kind of task as well. And this is Linda. Linda's a trainer on staff as well.
Do you want me to talk to you?
I do.
So this is Stetson, and Stetson will be 2 years old in July, and he's being trained to be a diabetic alert dog. We have many clients who are on a waiting list who have type 1 diabetes. And the client that we can serve is someone who's called a brittle diabetic, meaning that they have no sense or control of when they're going to have incredible highs and incredible lows as far as their diabetes goes. So we train these dogs to perform an alert based upon a scent that we are provided from people who have diabetes, who are experiencing a low. We have them breathe on a piece of gauze. I have a piece of gauze on right now, but this is a fake. This is a placebo, I guess. Dummy piece of gauze. We teach the dogs to know the difference. We want them to be able to smell the actual smell. So this is just something that shows them that it's not visible, it's something that you have to smell. So Stetson has been probably maybe about 3 months or so working on this. We hope to be able to place him very shortly, within maybe the next 6-8 weeks. And he has not really been challenged in an environment like this. So when we do a demo today, it's probably going to be something that he will be able to handle a little bit more easily.
Then the other program that we have is our autism program, where the dogs are trained to help children on the autism spectrum. And it's a 2-person placement, so the parent has the leash, but the dog is in service to the child. Actually, the dog sort of serves the whole family in many ways, but the dog keeps the child from being able to run away, because the kids with autism are often runners. The child and the dog are wearing like a little belting system together. They're tethered together. The parent will cue the dog to down and stay, and that's going to anchor the child. We also teach a number of other cues that are helpful. We teach a go bump. So if the child is doing a behavior that is repetitive and destructive, the parent can cue the dog to go and interrupt the behavior. We teach the dogs also to provide comfort by resting their head either on the child's lap or laying beside them. So there's a number of ways that we use the dogs for those kids as well.
So we can demo what some of the skills look like. So I will do some retrieve stuff with the river. So this is, I have just a few objects that would be typical that a client might drop. And what I need to ask for her to do is to get it for me, bring it, and release it when I tell her that I have it. So get it? Bring it? So we use the clicker to mark when they do a behavior correctly. It's something that they've learned. They charge the clicker at 8 weeks old. So she's had this for over 2 years of knowing that this is awesome. It marks the exact moment that they do a behavior that we're asking them to do, and they know that it means that they're going to get a treat for it. So they really want the treat, but this is the middle step for them. And it makes their training really precise. If I was just giving the treat, there's a time lag between when they did the behavior and when they're getting that reward. So it's a little sloppier of what they're getting the reward for. So this makes it very exact that they know what they did, and then they'll repeat it again, which is what we need in the training, that they'll do it consistently over and over. Repeat it. Bring it here. Good. So all of our dogs will learn a basic retrieve like this. It's a skill that is utilized by all of the different programs in one way or another, so it's something that they need to be able to learn to do in distracting environments like this. We started at the training center, but for them to focus, to pick up a pen when, kids are running past and things like that, it's something that's a lot harder for them. So we might be able to utilize like us doing retrieve in front of a soccer game, stuff like that. Get it? Hold. Give. Here. Bring it here. Give. I want to do it.
Oh, it's not torturing.
Maybe get it?
Steps.
She made it look very easy the first time.
She did. Oh. Yeah. Good girl. And then we try to get all the dogs to be able to pick up their leashes. River, get it? Bring it. Which is always their favorite. They know they get to go. Pick it up the leash. So that's example of a physical assistance. They also can tuck doors shut. They can hit door levers to open the door. River is learning to load laundry right now. Light switches. So you can get as creative as you can think with what they can physically do. So as long as they're able to do it with either their feet or their mouth, you can give it a go. And the clicker makes it a lot easier to get where you need to go. I'll just demo what the autism tethering looks like real quick, what the purpose of that downstay is for. So if there was a child attached to her and it seems, say I'm the mom and I want to go get some groceries and I want to make sure that my child isn't running off, I can cue River to do a downstay. Even if the kid is tugging or trying to go somewhere else, the dog just lies down so they know that that child isn't going anywhere. So we train the dog River down. Do a pretty quick down, stay, and that they can tolerate being tugged on. And the dog will be wearing a harness so the kid won't be actually tugging on her neck. But she's not going to break this. Even if have puppies are really cute, very, yay, like a little kid, woo! Release. So she'll only get up when she has permission. Good girl. But again, that's with the dog who can really really tolerate a kid being annoying, and not all dogs want to do that, so it takes a special dog.
Stay.
Yay!
Okay. Just so that you all understand, I had said that we've been working with Stetson with the diabetic alert for 3 months. That doesn't mean that we just started training him at 3 months. He's got to have all of the other skills, like Lauren was saying, because we kind of don't know until a certain point which track the dog's going to go. So he's been determined to be a diabetic alert dog because he uses his nose. So what do you all think would be the best way? Should I disappear, or do you think
So she's been wearing this dummy scent that doesn't actually have diabetic odor on it to get Stetson not thinking that it's anything but a visual cue to do the alert. And so the alert isn't doing a nose bump to your leg or whatever body part. So what she's going to do is she's going to go switch out to a dog's pad that has diabetic odor on it that was worn by a client who had a low blood sugar episode and sent these scent samples to us. And what we want Stetson to recognize is that now the odor is different on the dog's pad and it's what we care about, and that then he would initiate the alert. Linda might cue the alert because this is a different environment. We might need to go back a step for him and tell him, okay, yep, that's the scent, now do this, so that he can say, oh yeah, I got it. This is a different place, but same idea.
But first we're going to see if we can do it just on scent before we help him.
So I have the little piece of gauze in my back pocket in a plastic bag, so that's why he doesn't smell it right now. What are you watching?
It was funny.
Please, what are you watching? So I'm just going to walk around a little bit with them and see if we notice anything.
She's trying to walk the scent a little bit in this direction.
Yes,
Just
good
about
job. Good job. Yes, good job, Yes, nice work. So we have to make this a real party because this is a different environment for him. Yes.
His alert is bumping her with his nose.
Yay, Stats. Good work. Nice work, buddy.
You can see that the dogs all love to do what they
They love their jobs.
So then we try to switch up the position that we're in, try to make it kind of as different as it can be. Good boy. Nice work, Stats. Yes.
And so throughout their whole career, they're continuously rewarded for their actions, right? The treats don't stop with the training.
The client won't reward as much as we do during the training process. It's the clicker and the treats are most important for when they're learning a skill and not as much for maintenance, but we want to make them continue to love their work, and for them that probably means getting paid for it. So the client, we do tell the client to continue the food rewards and that kind of thing. A lot of them will transition to more verbal love and that kind of thing, but the good treat always helps. So we can demo a meet and greet, how we want one to work, for like if you're coming, if we're meeting on campus and you see us with the dogs and you want to say hi, kind of what the process should be to make sure it's okay, it's a good time. So I can take Rib and Peggy can be an appropriate meet and greeter to start. So we're just walk along and
A dog! Oh!
Can you hold on for a second, please? River down. Stay. possible. And so if River had gotten up while you were saying hi, I would ask you to stop petting, let me get her back down. We don't want the dogs to learn that they can initiate the meet and greet, because then they'll be hauling, like how he was pulling her up to say hi. It's not very appropriate. So we want the dogs to be very contained for that, and if they can't manage that, then they didn't earn the right to say hi to you. So as long as you just listen to what the handler is saying, whether it's okay or whether to stop for a second, it's usually okay to go through the meet and greet if it's done appropriately. With the puppies who don't have a formal downstay, we'll support them a lot more. It's not as crucial that they're in a down, but more just that they're paying attention to us. So still don't be all like gooey with the puppy. We want them to still be focused on the handler, but it doesn't have to be quite as precise in the position. But still, just ask the guidance of whoever the puppy is with or the dog's with. But we'll typically let you say hi to them whenever we're working together. So that's a meet and greet. Do you have any questions about anything or what else you might be able to help with?
With the diabetic episode, so when he touches your knee, is that just supposed to alert the client that she's
Exactly.
low?
That's the alert that we have taught him. So what we did is we paired the scent with that alert, which is the bump. And anytime they smell that smell, they should come up and alert.
Okay.
So for the client, it means if you get bumped, check your blood sugar, because the dog is telling you that it's not normal anymore. So they have to learn to trust the dog. When they're bumping you, it's only for a blood sugar reason, not for other things.
We talked about maybe creating distractions, playing a soccer game, for example, but what would you expect of us if we were to, say, be going to a crowded cafeteria today? What would our role be surrounding you with the dog and present while we tour you through the university? What would you expect of us?
Well, first it would be just showing us where to go.
And probably, whatever kind of pass you need to get in, we wouldn't have.
Right.
Mocking, going through as if we were to get food, go to the table, just kind of being, helping us be, as the students.
Okay.
If in that environment we want to do additional distractions or meet and greets or things like that, we could utilize you in that way. But largely in that type of situation, it would just be access and telling us, what and where to go.
Right. Is there like a certain distance we should stay away from the dog, or should we help to kind of guard the dog?
No, you could just walk in. If they were with a student, the student probably would be with a group of friends. So just normal, like casual walking distance. If you're with someone, you're this distance. So it's not like you have to be like 10 feet away or creating a barrier. You just casual. We'll tell you if you're distracting the dog, but that's something the dog needs to work through. Having close quarters. So that would be a good distraction for you to just be kind of tight, milling around.
Dropping things, that happens, and it doesn't mean that the dog needs to pick it up for you. It has to be something that happens because the handler asks them to, not just because stuff drops. So lots of things like that. We don't charge for the dogs, and so fundraising is a huge part of what we need to do.